Hi, John Abuff here from Wild Eye. As you know, Wild Eye takes many clients to great wildlife destinations throughout Africa. Our knowledge of Ebola is probably limited to the various media reports we've read, seen on TV, or by the various articles that have been shared on social media channels. And while it is prevalent in a very small part of the western side of Africa, which is situated several thousand kilometers away from the areas that we operate in, it is a real problem, a problem that we have to address, and a problem that we thought we would share and get further information for you. So we decided to get the opinion of an expert.
Thank you very much. My name is Dr Anchen Laubscher. I work for Netcare as the Medical Director. Netcare is a private healthcare organization in South Africa, managing 54 hospitals, primary care sites, remote site clinics in Africa, as well as Netcare 911, the emergency division, with the aeromedical division as well, also oncology and national renal care. Ebola virus disease was first discovered in 1976 in the DRC in two separate but simultaneous outbreaks, which is quite interesting that the climate was feasible or suitable for the Ebola virus disease to break out. Subsequent to those two outbreaks, there were some outbreaks, but this is the biggest one documented thus far. So Ebola virus is a virus, a filovirus. It's a family of viruses that causes viral hemorrhagic disease, characterized by bleeding, and that's the typical picture that we have in our minds, is the patient bleeding from the eyes and the nose and the ears. Important to know is that Ebola virus disease, first of all, how it is contracted. So you need to be a very close personal contact with someone. You need to share a house. You need to be really within 1 meter of a person and be in contact with bodily fluids. So any bodily fluids can spread the Ebola virus disease from one person to another. Not really airborne, but droplets certainly. Vomit, saliva, diarrhea, so people sharing toilet facilities in their houses, people sharing bathroom facilities, people sharing crockery and cutlery, and obviously people having sexual contact with each other. Those are the people that are at risk of contracting Ebola virus disease from a sick person. So it's really close human contact within 1 meter and bodily fluids. And that must be of a sick person. So the person must be symptomatic for you to get Ebola virus disease. There's a very long period from getting exposed to the disease to actually dying or becoming ill, which could be up to 21 days from exposure to actually showing some symptoms, in which time you are not infective. So it's only when you start showing symptoms that you become infective. The dangerous part is that those symptoms are flu-like symptoms. So they could be malaria or tick bite fever or many of the other conditions that we so commonly encounter in Africa. It could also just be a general flu or bacterial infection. So that makes it very important when you ask questions about people's exposure. So if you haven't been exposed to a patient with Ebola virus disease, chances are that you're not going to be at risk of contracting the virus. So Ebola virus, like I said, is a filovirus. It enters the bloodstream via any port of entry into the body, and then it takes up to 21 days to become symptomatic. In the first 2, 3, 4 days, you just generally flu-like, frontal headache, a bit of dehydration, some fever, high fever, over 38 degrees centigrade, sweating, general body aches, muscle aches, joint aches, diarrhea, vomiting. And then as the virus progresses from day 5 onwards, there could be some bleeding present as well, but as we know, it's not always present. Bleeding could be internal, and bleeding could also be external. Bleeding could be detected in the urine or in the feces or in the vomiting or the coughing of a patient, or it could be those characteristic pictures that we always see on the internet with people bleeding literally from their eyes and from their ears. So that's the progression of the disease. If it kills the patient around day 9, 8, 9. Patients die of multi-organ failure. So there's not in terms of treatment, there's no cure available and there's no vaccine available. The World Health Organization recently announced that there would be a vaccine available in the middle of 2015, round about the middle of 2015. But the point is that the most important thing about Ebola is to control the spread, and it's easy actually to do that if you are aware of what the risks are for getting yourself exposed. You can safeguard yourself against contracting the disease. So there's been, the virus started this time, the outbreak started in Guinea, the index patient was in Guinea. And before people even realized this, or before we realized that it was an outbreak, it spread quite rapidly to those 3 mainly affected countries, which is Liberia, Sierra Leone and Guinea. There are control measures in place. There's also WHO, UN, a lot of international involvement. I'm sure know about the American soldiers that have been sent there, knowing full well that actually to contain the spread, you have to control the movement of people and the exposure of people. So the countries have got trouble in terms of their healthcare systems actually not being able to deal with this. It's a huge burden on the healthcare system. Normal disease and normal course of living goes on. People need to give birth, people need to be admitted to hospital, people need to have surgeries. So those people have to come to hospitals where these Ebola patients are. So they are trying to separate the so-called Ebola hospitals from the normal hospitals and trying to get their normal medical healthcare systems to run, as well as dealing with the containment and the spread of Ebola virus disease. As the treatment of these patients is merely supportive. If they do recover, the case fatality rate is around about 50%. So not 50% of patients die, the other ones recover. And as I said, there's no cure, so the recovery is basically by good supportive measure and by your own natural immunity actually conquering this virus. But the countries do have trouble. There's a huge outcry for help, and that's why it's become such an international crisis, knowing full well that the borders in Africa are sometimes quite fluid, and people travel everywhere over Africa. You know, they travel by foot from West to East Africa. So the containment is the biggest focus at the moment, and there's huge international support to help these countries as they can't deal with it entirely on their own. Yeah, so the concern is what we call imported cases of Ebola. So the outbreak in Nigeria, which has now subsequently been declared under control, was because of a person from Liberia getting on an aeroplane and going to Lagos and then to Port Harcourt. So that is called an imported case. So that person literally displaced himself from his place where he got the virus to another place. And he had a lot of other contacts on the aeroplane. Those contacts then went into Lagos, Port Harcourt, went on with their lives. So there were thousands of contacts in Nigeria. So that was the first imported situation case, and they controlled that quite well, given the number of cases that were possibly affected. And they controlled the disease, and I think it was the 22nd of October that they declared them under control, which means that for 42 days since the last new case, there were no new cases in Nigeria. So we're well past that landmark. Nigeria, in fact, has contained their outbreak. It's important for traveling in Africa because Nigeria is a transport hub and a transport via hub. So it's important for us to know that Nigeria has controlled it so well. There was also an important case in Senegal, lots of contacts, but not as many as Nigeria, and also contained quite well. It was a medical person, a medical student, traveled home and reported herself to a primary healthcare clinic, and it was diagnosed and she was contained. Nobody died in Senegal. People did die in Nigeria. Nobody died in Senegal. It was contained and it was declared just 2 days before Nigeria as Ebola-free as well. Yes, so healthcare workers are particularly at risk, and that's because they are involved in the patients when they are in quite an advanced stage of the disease. So they're very infectious and they're very ill, and also they're in very close contact. And they deal with the patient's blood. They draw their blood to conduct blood tests. So healthcare workers in terms of doctors, nurses, lab technicians, people testing the blood, those people are at risk of contracting the disease much more than in the community where people are not exposed to blood, for example, and just to other bodily fluid on an ad hoc basis. So healthcare workers definitely. There's also been a slightly higher fatality rate in the healthcare workers who have contracted the disease, and it's possibly because it's so well documented. It's known that the rate and the numbers that we document in terms of fatalities and people contracting the disease is underreported in West Africa because not all of these people actually get to the authorities to be reported as Ebola cases. They also want to bury their family members in their own tradition, and they don't want them to be taken away and to be cremated. So there's the underreporting going on in terms of the community, and that's why the healthcare numbers are slightly higher. But certainly, in terms of being in close contact with people, being in contact with bodily fluids, being a healthcare worker, it makes sense that you are at a much higher risk. When the bodily fluid leaves the host, and for example, saliva lands on this desk, now it's exposed to environmental factors such as heat and such as sunlight, and it's not clearly documented, but up to 48 hours the virus could survive outside of the body. But still, at-risk cases are considered people who had contact with people. And that's how transmission takes place. It's people having contact with people. It's not really from surfaces or from environmental factors. In the eastern parts of Africa, there have been no cases documented, not in Kenya, not in Tanzania, not in the whole of Africa, other than the 3 countries where it started, so Guinea, Sierra Leone, and Liberia. Nigeria and Senegal, as I've stated, who have contained their outbreaks. There was one case in Mali of a little girl who traveled by bus after her mum died in Liberia from Ebola virus disease to Mali. She died. And they are following up the contacts in Mali, but there have not been any subsequent cases following that one little girl's death. So no other countries in northern, eastern, or southern Africa, and then Spain and the United States, as we well know from the international news, have been affected, but no other countries in Africa. No, nothing in southern Africa. So we are very vigilant, the whole of the South African healthcare industry, about the fact that we bring lots of patients in, lots of patients seek medical help in South Africa or southern Africa because of the quality of healthcare that is rendered in the South African hospitals. So we've got large numbers of cases coming for, elective cases coming from surgery or for medical treatment. We also have patients that has to be evacuated from African countries because there's not sufficient medical care to South Africa. And all of those patients, wherever they are in Africa, has to go through a rigorous risk assessment process to determine whether they have been exposed to the virus or not. And in any of those cases in the eastern, northern and southern countries, we have not even found cases at risk. It's really around the West African countries that the risk cases are, and that the vigilance is for traveling in the whole of Africa, knowing that people travel quite liberally from the west to the east and the north to the south, but there has not been any high risk or suspected cases even in East Africa. Yes, there's quite a big educational campaign and initiative at all the airports. You'll see that you are being alerted to the fact that you must watch out for the following symptoms having travelled to these areas. There's 2 things. You will be given a questionnaire in terms of travel and exposure as you land into the country, that will be taken by the port health authorities for contact tracing. And then the second thing is that you'll be screened by a camera for your temperature. So as you go through passport control in any of the South African airports or any of the other border control areas, you'll be scanned by a thermo scan to determine whether your body temperature is slightly elevated or not. And if it is the case, then you will be taken into quarantine and examined and questioned before you are allowed to leave the airport. Yes, it's instituted in all the countries in Africa. Even if you travel in Europe at the moment, you will be given Ebola leaflets or information pieces, not necessarily the travel scanning, the temperature scanning, but it is implemented across Africa, yes. I think it is. I think that I would not travel to the Western African countries. In fact, there are travel restrictions in those countries, and you won't be able to leave those, necessarily leave those countries for your country of origin. But in terms of the rest of Africa, I think that it's fairly safe to travel there. We're always exposed to sick people wherever we travel in the world, and I think it's important to have basic distance, maintain a basic interpersonal distance with people. Wash your hands, basic strong chlorhexidine destroys most germs. Have good hand hygiene, have good general hygiene. Stay away from people who are sneezing, who are fluish. The same way you avoid any form of virus or any form of flu or bacterial infection when you're traveling. So you can be exposed to someone who travels with you, but because of all these border controls and because of all these processes, chances that you will encounter someone like that on a plane are getting less and less. And therefore I think it is safe to travel, especially to the northern, eastern and southern parts of Africa, where South Africa is a huge continent and those areas have not been affected. I think the media has got a very important role to play in this whole outbreak. I think from an educational perspective, I certainly watch BBC constantly to see what's going on in the world, not just about Ebola. I think they've got an important role to play, but I think they also become very sensationalistic about especially in South Africa. And I think that we haven't had a case, but every single case that was almost a case or a suspected case or just random queries coming out of the blue, they really, it's almost like they can't wait for the drama and the pandemonium of the first case to break out. And I think one has to caution the media and the general public just to stay calm around this issue. It doesn't help, even if you talk to the healthcare workers in the situation, it doesn't help to get all stressed out and get involved in all the drama around this. It's just stay calm, be responsible. The role of the media is to educate people about risks and to educate people about what the world can do to help these Ebola-stricken regions, and educate them about the disease and the reality of the situation, but not over-dramatize it. I think they have reported responsibly thus far, but I do think that there's the risk of them becoming too sensationalistic about it.